So the first thing I'm going to do with medication administration is I'm going to go to my med cart and I'm going to unlock it, grab my specific drawer to my patient, make sure it's correct, and it is. Put it on my table and lock the med cart back. Throughout this whole procedure, I'm going to demonstrate the 6 rights of medication administration, which is right patient, right drug, right dose, right route, right time, and right documentation. So the first thing I'm going to do is I'm going to just compare my physician's order, my MAR, to the things that I'm giving today, the medications. So I'm going to give a TB skin test, 0.1 mLs now, matches, and the expiration date's good. Then I'm going to give my IM injection, cyanosulbulmin, 1,000 micrograms IM, 1,000 micrograms IM, expiration date is good. Humalog, which is insulin Lispro, 100 units per 6 units sub-Q, 6 units sub-Q. Then I'm going to give milk and magnesia, 30 mLs every 6 hours. The expiration date's good. Milk and magnesia every 6 hours. Then I'm going to give my mupirocin, 2% ointment to the right arm daily, 2% ointment to the right arm daily, and expiration date is good. So now I'm going to go ahead and put this up. So I'm going to unlock my med cart, put it back in there, and lock it back. And then I'm going to do my second check with any math that I need to do. And I'm going to look up with my drug cards so I know, so I can look at what the drug is going to be used for, the contraindications of the drug, the adverse effects, the nursing considerations, and the correct dosage to see if it was in the limits. So I'm going to look at all of that. So TB, I can put the physician's order away. So the TB skin test, 0.1, expiration date's good. TB, and I'm just noting what it's for, what to teach my patient, the adverse effects of it, contraindications. Cyanosulbulmin, my IM, I'm looking at that. The same things, what it's used for, nursing consideration. The treatment of overdose is important for this one too. Insulin Lispro, 6 units. And I'm going to look at the same thing with my drug card. And it's correct. Expiration date's still good. Contraindications, nursing consideration. Milk and mag, 30 milliliters. Expiration date's good. I'm going to look at my milk and mag. I'm going to look at everything in that one. And then I'm going to look at my mupirocin lastly. 2% ointment, right arm daily. And this is my last drug to check. Nursing considerations, adverse effects, contraindications, dosage, and everything is correct for all of the medications I'm going to be given. So I'm going to go ahead and set this to the side. So now I'm going to start to prepare my medications. So the first one I'm going to do is my TB skin test, and I'm going to be using the 27 gauge half-inch. And the top, so I'm giving 0.1. Make sure it's correct, 0.1. I'm going to draw 0.1 up with the air. And then insert it without touching the hub to the top of the medicine. I'm going to withdraw 0.1 mLs. Cap my medication. Make sure there's no bubbles. If there is, I'll just do that. Okay. There's my TB skin test. Can you see it? You can lay it down if you can't. So then I'm gonna just go ahead and label. So I'm gonna write down what's needed. The TB skin test 0.1 mLs intradermal. So my TB skin test is ready. I'm going to go ahead and draw up with air for the circumstances, and it's drawn up with air. So then I'm going to do my sign of Ballman. And with this one, it's an IM injection, so I'm just going to make sure it's correct for my third check. The math that I had to do was 1,000 micrograms per ml, so I'm just going to give 1 ml. So I'm just going to clean the top. I'm using a 22 gauge and a 1.5 inch needle. I'm going to drop, I'm giving 1 ml. Make sure that's correct. I'm not second guessing. So I've cleaned the top of my hub. So now I'm ready to inject. And you don't touch the hub to the medicine cap. So I got 1 ml. Cap without using both hands. Get rid of any bubbles that may be there. So I have 1 ml. Okay. So now I'm going to switch my needle. Having some difficulty. I don't know if I'm going to be able to get it. Okay, so without touching, oh, I've done the wrong side, that's why. So without touching the hub, I'm not touching it. Now I have a brand new syringe. Throw that away. So I'm good to go with my needle. So now I'm going to discard this since I'm not using it in the mannequin. Draw 1 ml. So I have 1 ml of air. Of course, I've already. So now I'm going to cyanocobalamin 1,000. I'm going to give 1 ml IM. It's ready to go. Done my third check on that one. Next is my insulin Lispro. Scrub the hub. And I'm giving 6 units, so I've already checked my thing for expiration date and the correct medicine. Don't touch the hub. 6 units of insulin. See it? So on this one, I'm gonna get a nurse to come check this for my 3rd check because it's a high alert drug and it has to be correct. So I'm gonna get a nurse, I'm gonna call a nurse in here to come check or before I go into the patient room. So this one's good. Go ahead and check this. Um, 6 units of air for the patient, for the mannequin. Now I'm gonna get my milk of magnesia, 30 milliliters. So I checked it, the expiration date's good, the medicine's good. So I'm gonna bend down to be at eye level. I'm gonna turn it to where I have the correct dosage. So that's 30 mLs if you want to check it. Hold on, let me turn it around. See it? So this one's ready. I'm gonna go ahead and pour this back in. And then I'm just gonna check my ointment, lastly. 2% ointment to the right arm. And that's correct. So I forgot to put my sticker on here, so I'm gonna go ahead and move my insulin. This bro, 6 units, so cute. And you're gonna take this with meals. My patient will take this with meals. All right, so now we're going to go into the patient room and go get some meds. Knock, knock, knock. Hi, my name's McKenna. I'm here to give you some meds and some injections this morning. How are you? Good. Okay. So I have a couple things I've got to give you. So just bear with me. Would you like to do injections or would you like to do your oral medications first? You want to do your oral? Okay. So can you say to me your name and your date of birth real quick? And what are your allergies? You don't have any? Perfect. Okay, so I'm gonna lift you up. Make sure the patient is up and up. The first one is milk and magnesia. I'm gonna do 30 milliliters. This is PRN for constipation. It'll kind of give you some relief with that. So here is your milk of magnesia. Do you want me to help you with that? Okay. Do you need a drink of water? No? All right. Did you have any problems swallowing that? No, okay. So next we're gonna do your topical ointment to your right arm. So the first thing we're gonna do is I have a towel. I would get it soapy or just cleanse the site of the right arm. Just cleanse it, make sure it's clean so we can get rid of any of that drainage or bacteria that's on the outer surface of the wound. So I would get rid of that after I've cleaned it and it's all good. So now I'm just gonna, I've already done my 3rd check, so I'm okay. I'm just gonna get some on my finger and just do a thin layer. Okay. Now I'm gonna give you some injections, so I'm going to lay your head down. The first one I'm going to do is I'm going to give you a TB skin test. Have you ever had one? You have? Did you have any adverse reactions or anything happen? No? Okay. So we're gonna do that in your forearm. Do you prefer your right or left? Okay. We'll do it in. We're doing it in your right arm. So I'm giving 0.1 intradermal. So the way I'm going to find this is I'm going to put a hand below the elbow and a hand on the wrist. And it's going to be in the middle. Make sure it's not over any cirrhosis or damage to the skin. And make sure it's not in over any, foreseeable veins that could be possible to be hit. So we're going to read this in about 48 to 72 hours. And if you have any questions, just let me know. I would wait for the skin to dry. So I'm going to insert it with the bevel up at a 15-degree angle. The next one we're going to do is your insulin. We're going to give that one on the posterior part of your arm. So I'm going to have you turn your arm. So I would measure this. It's in the fatty part of the posterior, the back side of the arm. So if I can pinch an inch, then I'm good. So I'm going to do it not up in the armpit area, but not in the elbow. Just kind of, I call it the bingo arm. Not everybody has one, but. Okay, so I'm giving 6 units of insulin today, and I've already had a nurse check my measurements. So I'm gonna wait for that to dry. Then I make sure I can pinch an inch. Stick it in. Then I would apply cotton or anything if it was bleeding. Make sure the patient didn't get blood all over his or her bed. And the next one we're going to do is we're going to do an IM injection, and it's going to go in your vastus lateralis. The way I find that is I do a hand below the groin, a hand above the knee, and then I kind of try to touch my thumbs. My hands are really small, so I'm going to do it kind of in the middle of right here. So I have my spot. I'm going to cleanse the area. I'm going to wait for that to dry. I'm going to instruct my patient that it's going to be a prick, so just be ready, all right? 1, 2, 3. I gave 1 milliliter. And then I would apply cotton if it was bleeding, if I needed to do that. Wash my hands. And then I would just make sure my patient was okay. Are you okay? Are you having any kind of discomfort or pain? Okay, I'll be back in 30 minutes to check on you to make sure you're okay with your medication. If you need anything before that, just let me know. If you notice anything out of the ordinary, just push your button and let us know. So I'm gonna make sure our patient has their coli, lower their bed. Are you okay with laying down, or would you like to sit up? You're gonna lay down for a while. Okay. So I'll clean up my mess off the bed so I can roll my card out. Pull back the curtain. wash my hands, and the things I would, after leaving the room, I would document the route, the time. I would put my initials, which is MG with a comma, student nurse, which is SN. And then at the bottom I would sign M. Gill, student nurse. And I would just go back and check my patient in about 30 minutes.